My name's Michelle Warnes. I'm the Accounts Director for Australia and New Zealand for Personify Care. Also a background as a registered nurse.
Oh, cool. Excellent. And Personify Care, partners for Talking Health Tech. We've covered a fair bit of content on the podcast in the past and looking forward to doing some longer form stuff in the future. But it's great to see you at Digital Health Week here in New Zealand. Tell us why you're here.
Well, it was opportune. We've got a number of customers over here, so came over to visit some of the customers, but also presenting today, actually, this morning. We put in an abstract around some results from a case study that we did with Royston Hospital. And unfortunately, they couldn't join us here today, but I'll be sharing those results and talking a little bit about some of our use cases.
Yeah, excellent. I'm glad you have got a chance to do a dry run of the presentation now too. So, but no, tell us a bit more about that case study and the implementation.
Yeah, sure. So the focus was around building a digital patient journey for pre-admission and post-discharge. And with Royston, we actually chose to specialise that pathway from a starting point. So we started off with a focus in orthopedics and gastroenterology, where we provided patients coming in for those procedures all the information that they needed ahead of that, including collecting a health questionnaire, screening that smartly, to provide the clinicians with a dashboard to see who they needed to follow up versus those patients that didn't need any follow-up, and then also a post-discharge check-in. So saw some great results. They did a lot of measurements beforehand to see the time it was consuming in their teams to do some of those tasks manually. So after digitising their workflow, they were able to reduce their preoperative phone calls for their clinicians by 60%. And their post-discharge calls by 94%. By using the smart screening, flagging to their attention those that might need some follow-up, that might sit outside their exceptions. So if they've got certain BMI cutoffs or information about cardiac history or infections, those patients that fill out that information and it sits outside that range, it flags on their dashboard. So those are the patients that they know that they need to call and check in on and follow up ahead of the day to make sure that they've covered off everything.
Yeah. Well, that's cool. And so that's great to be able to reduce that preoperative and post follow-up time, especially for the clinicians as well. And so you mentioned, it's flagging it for the clinician when the patient is completing that form. Is it that it's helping triage that information, so the ones that don't need it are kind of then don't need to have much attention, or is it the prioritization in the task up front, or is it there's some intelligence through the process to kind of make the most effective time while you've got a patient and a clinician in the same time? Like how do you actually reduce that amount of time to do?
Yeah, it's a really good question, and I think where the pathway lends itself nicely to providing patients that don't need that call with all the information they need. In this particular instance, with patients that were coming in for arthroplasty, so hip and knee surgery, providing them with information about their surgeon that they're going to see, a picture of them, a little bit of history about their surgeon, maybe what to expect preoperatively, how to prepare for that. And then also providing them with, if a patient fills out their health questionnaire, their health information determines a delivery of a smart blood form that they then go and have bloods taken as well. So there's a lot of smarts in that pathway where patients are really comprehensively educated and informed ahead of that appointment. Whereas those that are triggering those flags, the feedback I actually had from the staff was saying that it was a rich conversation that they had and a lot more efficient, that phone call, because they had the information in front of them and they could target the important parts to follow up with the patient.
No, that's cool. And I guess it does speak to the importance of having that being, that preparedness and setting those expectations and the amount that can pay off in dividends afterwards that flows onwards. And I feel like sometimes there's, in the busyness of clinical day to day, really kind of looking at the workflow, seeing how we can optimize it. It feels like inefficient time in that kind of planning phase. But I guess if you can get that piece right and work with the right people, it can then pay off for a much longer time. So investing in that upfront preparedness.
Oh, absolutely. There's a lot to be said for creating expectations for patients ahead of surgery, which then helps them upon their timely discharge. Another point they made was for some reason patients that were coming in for endoscopies and colonoscopies thought they would come in at 11 and leave by 12.
Right.
And so there was a little bit of education put in the pathway that explains you'll be on site for 3 hours, have your carer pick you up. And they found that actually reduced a ton of phone calls for the admin team, for the carers that were calling to say, when am I coming? Has my partner finished their procedure yet? So again, creating expectations has a lot to be said for streamlining and making that post-discharge a lot smoother.
Yeah, excellent. And so it sounds like a really good use case in that particular case study, which is great to be able to share with attendees here at Digital Health Week to see these types of solutions in action. Where to from here for Personify Care? I know you're working with many hospitals in Australia and New Zealand. Where's your focus into 2025 and beyond?
Yeah, very good question. Love to get into the public sector over here. I know there's some huge challenges ahead of us at the moment, particularly we've heard a lot in the last week. But we're actually going to visit a doctor at Green Lane Clinical Centre this afternoon who's really interested in... He actually spoke to Ken a couple of weeks ago, and he's doing a lot of the screening himself in the orthopedic clinic. He's lost a lot of staff and saw Ken present in Melbourne, actually, a couple of weeks ago and just said, I need something like that. I'm doing a lot of the work myself. So, look, there's a need. I think there's a huge bonus with Personify Care in the speed at which you can get something up and running very quickly. We're doing a lot of work in the public sector across Australia, very focused in outpatients at the moment. We're doing a lot of work and solving a lot of problems there. I think it's onwards and upwards from here. We've just launched in Canada. We've got some great partnerships happening as well. So, exciting times.